Hello, Julie. It's so nice to have you on the show today. How are you doing?
Doing well, thank you. Appreciate you having me as a guest.
Beautiful. And thank you so very much for being here. You see, I truly appreciate you. And you see, Julie, oftentimes I love to thank my guest for two things. And I do this so often to the point where it has become my anthem. So, firstly, I want to say thank you so very much, Julie, for investing in yourself. You see, you are on this platform right now because you did invested in yourself. And oftentimes, Julie, I love to make reference to the amazing mango tree. You see, some couple of months back, I was on a particular road, and just by the roadside, Julie, there was this very tall, unattractive mango tree. And I used the word unattractive because the mango tree's got no mangoes on it, and the leaves were all dry. So I just walked past it and I went my way. But you see, Julie, just recently, I was on that same road. And this time around, a lot's changed about the mango tree, you see. The mango tree caught my attention pretty good from a distance, and immediately I got the urge to move so close to it, of which I did, and it wowed me. Because now the mango tree's got a lot of mangoes on it, beautiful green leaves and healthy branches, and not just mangoes now, Julie. I'm talking about ripe mangoes. It was such a lovely experience that day. I was so excited. Here is my point. The fact that you dedicated your time, energy, and resources to becoming the amazing Julie that you are today, that alone has made it impossible for me to skip you. And that's why you got the request from me to be on the show because I was attracted to the fruit of all that you're doing. Your philosophies, your insight, the impact your work is having, and how you are offering your solutions. These stuffs are beautiful, Julie. And just before I sent you that request, I said to myself, I've got to benefit from these beautiful things Julie is doing. And not only me now, because I don't want to be selfish, and even with the audience. And here we are today with the incredible Julie. So thank you so very much for doing that to yourself. And secondly, thank you for saying yes to the invite. Because if you had said nope, there was nothing Elisha could do about it. Thanks so much.
Thank you.
Beautiful. So let's get started. You see, I am quite excited to have you on the show today, Julie, for some reasons. Firstly, my interest in knowledge seeking. I believe in order for one to transition from a terrible situation to that of a beautiful one, Julie, I believe it takes the application of knowledge, quality information, and not just knowledge now, but the application of it. And you see, ever since I discovered that light in the Hebrew means knowledge, in darkness, ignorance, I've been so keen to knowledge seeking. Why? Because I do not want to remain in the dark. So that's going to make our conversation today very important to me and even to the listeners. And the second reason why I'm excited to have the incredible Julie on the show is for the sake of the audience. You see, we live in an age where information is as abundant as grains of sand. We've got a lot of information flying out there. So those folks trust me for quality, eye-opening, and very important information, of which I am totally convinced, Julie, that our conversation is going to be insightful and impactful. So for that reason, let's get started with your introduction. Talk to us about your personal or your professional journey, because right now we are so curious. We want to know how Julie got here. Then afterwards, I've gotten some beautiful questions for you. Okay, Julie, over to you.
It has been a journey. I started in nursing school way back decades ago, right after I finished high school. And I spent about 30 years taking care of patients in the ICU, working in the trauma center. I spent 10 years as a flight nurse on the helicopter. And then in 2009, so 16 years ago, entered the university to teach nursing students. And during that process, I began working on my master's degree and then my doctoral project, um, and found that medical harm, medical mistakes were the third leading cause of death. And it shocked me because I had already been a nurse for 30 years. How did I not know this? And so I started researching, and that developed the desire in me to find some kind of solution to change the trajectory of patient harm.
Wow, Julie, that's that's really incredible and profound. But the other part where you mentioned patient harm, that's really sad. Wow. And I never knew that, you see. I never knew that. Well, thank you so very much for all that you're doing. So let's begin with this, okay? What are the hidden risks of hospitalization most people don't see? Can you talk to us about that?
Yeah, I think as a society and a people, we assume because a doctor went to medical school for 12 years, nurses go to school for 4 or 5 or 6 years, that we can just let them take care of us and restore our health. But the complexities of healthcare line up systems to allow mistakes to happen. Yes, it is a human that will make a medication error, but it's for that same example, it's a system that maybe has not enough nurses. So the staffing is challenging and difficult, and the nurses hurry because they're taking care of multiple patients. Or, there's another example of technology, which is great, but in the US, the electronic health records that we document patient care and organize their medications and all of that have their challenges as well. For example, one of them is called alert fatigue. So if the physician is writing an order for a prescription or for a medication, and the system alerts um, multiple reasons, but 85% of those alerts are nonsense, meaning they don't apply. And so the healthcare team, whether it's the doctors or the nurse, learn to ignore the alerts. So while electronic health records are a benefit, they also have caused another big problem that we have to resolve. Um, and there are so many different ways that harm can occur in the hospital, whether it's a medication error or mistake, like we just talked about, or one in every 31 patients in American hospitals get a hospital acquired infection. That's another big problem. And some of those infections can actually kill patients. So, during all this research, that's why I wrote my book a couple of years ago to help patients and families be aware, because my goal is to inform, to educate, and empower patients to learn how to speak up, to learn how to ask questions, and to really be vigilant in watching over their loved ones in the hospital.
Wow. Isn't hospital supposed to be the most healthiest place? Wow. That's
You would think.
I tell you. I tell you, these stories are really, really shocking, Okay, so what about this one? Let's talk about speaking up and staying safe. How can patients speak up without being dismissed?
That's a good question. I think the best way to approach speaking as a family member or even a patient to a healthcare provider, whether it's the nurse, the respiratory therapist, or the doctor, whoever it may be, approach it with politeness and approach it from the perspective of curiosity. And so, for example, you could say, I'm really wondering why my mother looks so pale and she doesn't seem like herself. Can you help me understand what's going on after her surgery? And approaching it that way. Now, you may not get the answer you're looking for, and you may be dismissed, but we also have what I call the cuss words, which are words we can use when we're concerned, uncomfortable, scared, or we believe that there's a safety issue or safety problem. And so if we start the conversation or use one of those words in further conversation, let's just say in that example, a nurse says, "Oh, she'll be fine. That's pretty normal after surgery." you as a family member could say, well, I'm really uncomfortable with her being confused. This is not like my mother. What could be going on? And then we have an escalation pathway. We have the nurse, the charge nurse, the house supervisor, and then the hospitals have an administrator on call. So I say, if you're concerned, there's a reason, even if you can't articulate it in a medical terminology, it doesn't matter. If you really believe something is wrong or going on or not right, we must speak up. And part of what I do too is try to educate the healthcare professionals to listen. It really is a two-way street.
Beautiful. We must speak up. Got that. So you mentioned you wrote a beautiful book to address all of this stuff. What is the title of your book and how was the process of writing it like?
Yes, it is called Surviving Your Hospital Stay. And the subtitle is A Nurse Educator's Guide to Staying Safe and Living to Tell About It.
That's a powerful
It's got,
title. Yeah.
yeah, thank you. It has 30 stories in it. Unfortunately, they're all true, and most of them don't have good outcomes. But I feel like patients and families really can relate to stories and situations. And if they read it and then find themselves in a similar situation, hopefully they can remember this story, and that will give them the confidence to speak up and say, no, I know you said everything's okay, but I don't feel like it is, because speaking up honestly can make the difference in life and death.
Hmm. And that's a smart one, adding those stories because we tend to always remember stories more. Wow, that's a great one. Okay, so let's look at, you mentioned hospital mistakes. Okay, excuse me. So, what are the top five mistakes hospitals make? Can you talk to us about some?
Sure. Well, communication errors. The research tells us that communication breakdowns between anybody revolving around the patient. So between doctors and nurses, or doctor to doctor, or two family members, back and forth both ways. Communication errors being responsible for 70% of patient harm is a great place to start creating interventions and remedies to prevent the communication breakdown. A lot of that happens at shift change when the day shift nurse is ready to go home and they give handoff report to the next nurse. They may not remember all the critical things or the important things to relay. And a lot of times it doesn't make it into the patient's chart. And that's why I always advise patients and their families to take notes. If the nurse comes in and gives a pain medication, you ask, what is that medication? What's it supposed to do? And what should we watch for? So just take notes, because sometimes what you'll find is when for instance, a doctor comes in and says, okay, we're going to do this test, or we're going to start this medication. And you look at your notes and say, well, the doctor yesterday said something different. And it's not trying to be controversial, but it's trying to make sure things don't fall in the cracks. That's one really important one, is communication. The second one, medication errors, are the top most frequent mistakes. Now, not all medication errors hurt a patient, but many of them do, and sometimes they kill a patient. So it's very important. In fact, we teach in nursing school the 5 rights of safe medication administration. Do we have the right patient? Do we have the right medication? Do we have the right dose, the time, and the route? How are we giving this medication? Is it ordered IV and we're giving it that way? So medication errors are probably the second biggest problem.
Wow, this is very, very educated. Okay, you wanted to say something.
I was just going to say, diagnostic errors are another really big problem that impact almost 800,000 patients a year. So, for example, one of the stories in my book talks about a man who had a brain tumor. They took him for surgery, and the surgeon came out and told the wife. And then when the husband woke up from the anesthesia, told him too, don't worry, it looks like the tumor was benign. Well, they always send a pathology sample, a biopsy to the lab to get it analyzed. And the report came back that it was cancer, but the report got misfiled. And so for 6 months, the husband and wife thought, no worries. And then his pain came back, his headaches and symptoms. And that's when they went in and did surgery again and found the original pathology report. So that's another thing that I always recommend is don't assume if you don't hear anything that everything's normal. Make sure you get your own results, whether it's a chest x-ray, whether it's laboratory results, whether it's a biopsy, it doesn't matter. Make sure you get that in writing so you can see for yourself.
Beautiful. And thank you for sharing that story. Wow. Okay, we have two more to go. Okay. So how can patients partner with nurses without overstepping?
I try to teach the nursing students again that patients' families have to be part of the healthcare team because the information that they can share with us, a nurse comes in the room and does their thing, but the patient's family, if they're there at the bedside, are there to let us know, hey, this isn't normal or I'm concerned. So they can be our best helpers when we're stressed and we have too many patients and we can't be in two or three or four or five places at once. The family can really help us. And I think if the family approach the nurses and the healthcare team and say, I'm here to help, I'm here to make your job a little bit easier. What can I do? Let's just say your dad had surgery. You as a son could say, what should I watch for? What should I report to you that would be a concern that we would need to escalate that and find out what's causing, the problem, whether it's a rapid breathing rate or a slow breathing rate or unmanageable pain. What are those things as me as a family member can bring to you as the nurse that we can solve these problems together? And I think that's the best approach is just partnering together.
Beautiful. And that's a smart one. I got that. Now I see why you're so good at what you do. Amazing. So finally,
Thank you.
yeah, what would you like to leave the audience with? Like a final thought, and to those folks who would like to reach out to you, learn more about the beautiful stuff you're doing, or even make a purchase of your resources or books. How can that be possible?
Yes, I do want to say that I am hopeful, even though I talk about a lot of the problems. But I think that's the only way we're going to fix these problems is raising the awareness of what goes on behind closed doors, or what I call the Wizard of Oz curtain of healthcare. I think getting engaged and being an active participant in your health is really the best way to remain safe because then you understand what questions to ask, how to ask, what research should you do on your own, what kind of learning can you do before you even go into the hospital. One of the tips I give in my book is that in the US, there are hospitals that are rated for safety. And there's a free website. It's a nonprofit organization, and it's called hospitalsafetygrade.org. And if you're planning a surgery or if you have cardiac issues and you go to the hospital on a regular basis, or you're planning you may have to, look up the hospitals in your area and see how they're rated. In fact, I was talking to a girl the other day. She's lives in upstate New York and is 7 months pregnant. And while we were on the call, she looked up the hospital where she was planning to give birth and found out that that hospital was rated a C. So they're rated A through F. And just like your college papers, A means you did really well and F means you flunked, right?
Right.
And she found a hospital 30 minutes away that was an A rated hospital. So she's changing where she's planning on having that baby because she wants the best outcomes. Obviously, we all do. So I think those are, again, really empowering things to know and to understand. So I am hopeful. I am hopeful that, as you said when we started out this podcast, that coming out of the darkness of not knowing enlightens you to be proactive and an active participant. So, yes, anyone can find my book on either my website or Amazon. All my social media is drjuliesiemers.com, my website. But I also am making an app for patients and their families. I'm taking the chapters in the book and making a course where patients and families can take a deep dive and, you know, benefit from my 46 years of experience and my knowledge from the research and really become empowered.
That's so incredible, Julie, and I love that. You see, you've just opened my eyes to a series of things I never knew before. I never knew that hospitals also have grades. This is amazing. This is amazing, I tell you. Thank you so very much. So that's going to be the end of the show, Julie. Thank you for coming and thank you for sharing this wonderful stuff with us. It means a whole lot. Thank you.
You're welcome and thank you.